Good morning. It's August 14th, and this is your daily brief in science. Here's everything you need to know. A new machine learning algorithm has emerged that could revolutionize disease diagnosis by analyzing tongue color with remarkable accuracy. Developed by researchers from Middle Technical University in Iraq and the University of South Australia, this innovative AI system has achieved an impressive 98% accuracy rate in identifying health conditions. This technology is a modern adaptation of traditional diagnostic practices rooted in Chinese medicine, which have been in use for over 2,000 years. The algorithm evaluates various features of the tongue, such as color, shape, and thickness, to diagnose a range of diseases, including diabetes, stroke, and COVID-19. To create this system, researchers utilized a dataset of over 5,260 tongue images, allowing the AI to make accurate predictions based on tongue coloration. The model was validated using 60 images from patients at 2 teaching hospitals in the Middle East, achieving a near-perfect match between tongue color and correct diagnoses. The diagnostic process involves capturing real-time images of the tongue with a webcam positioned about 20 centimeters away, which has proven effective in providing accurate results. However, challenges persist, including patient reluctance to share tongue images and potential issues with camera reflections that could impact diagnostic accuracy. Looking ahead, researchers aim to integrate this technology into smartphones, enabling convenient, real-time health assessments, especially in remote areas. This advancement has the potential to enhance early disease detection and management, democratizing healthcare and improving health outcomes globally. The findings were published in the journal Technologies, highlighting the promise of computerized tongue analysis in advancing medical diagnostics. This research emphasizes the importance of merging traditional medical practices with modern technology for more effective disease screening. A recent meta-analysis has upended long-held beliefs about alcohol consumption and health. It concludes that no amount of alcohol improves health, directly challenging decades of research that suggested moderate drinking offered benefits. The study reveals that even low-risk drinking is associated with an 11% higher risk of dying from cancer compared to those who drink occasionally. Moderate drinking, defined as 20 to 40 grams daily for men and 10 to 20 grams for women, correlates with an increased risk of death from all causes, particularly cancer. Additionally, high-risk drinking, which includes consuming at least 2 pints of cider daily for men or 1 for women, is linked to a 33% higher risk of death from any cause compared to occasional drinkers. The harmful effects of both moderate and low-risk drinking are notably more pronounced among individuals with poorer health or those living in deprived areas. Interestingly, the study found that a preference for wine or drinking only with meals may lower the risk of death, potentially due to factors like slower alcohol absorption. The findings suggest that alcohol may increase cancer risk from the first drop, indicating that even light drinking can be harmful. Lead author Dr. Rosario Ortola emphasized that there is no evidence supporting a health benefit from low drinking regarding overall mortality. The study argues that previous research was flawed, often comparing drinkers to sick individuals who do not drink, potentially skewing results. However, skepticism about these findings has emerged from various experts, indicating that the debate over alcohol consumption and health remains unresolved. Critics have accused lead researcher Tim Stockwell of cherry-picking evidence to support his conclusions, raising concerns about potential biases in his research. The World Health Organization acknowledges that even low-level alcohol consumption can pose health risks, aligning with the study's findings. Mixed reality technology is transforming the construction industry, significantly enhancing processes related to building inspection and monitoring. This innovation leads to improved efficiency, accuracy, and safety across various construction activities. By integrating virtual and real-world elements, mixed reality allows users to interact with digital information within their physical environment, streamlining inspection and monitoring tasks. The applications of mixed reality in construction include effective building inspections, construction defect management, safety enhancements, and improved design collaboration. However, the adoption of this technology is not without challenges. High costs, technological limitations, and a lack of technical skills among users are barriers that the industry must overcome. The construction sector is facing issues such as project complexity, low productivity, cost overruns, and safety concerns. Mixed reality aims to address these challenges by enhancing visualization, communication, and collaboration among stakeholders, providing real-time data that supports quick decision-making. One notable development in this field is the proposed Robot Collaboration System, or ROCOS. This system creates a digital twin environment that facilitates an iterative design process between designers and robots, operating in 3 stages: layout, design, and assembly. Recent advancements include a new algorithm for extracting feature lines from building roof point clouds, which is essential for accurate 3D building reconstruction. Experimental validation of point cloud registration methods in semi-finished houses has shown their feasibility and effectiveness in improving construction accuracy. Looking ahead, the future of alignment methods in mixed reality may shift toward algorithmic approaches, potentially replacing traditional methods. A comprehensive study on this subject, authored by Jinzheng Yu and colleagues, was published in Remote Sensing on August 13, 2024, emphasizing the transformative potential of mixed reality in the construction industry. President Joe Biden is gearing up to announce a significant investment of $150 million in federal funding aimed at advancing tumor removal technologies. This announcement will take place during his visit to New Orleans and is part of the Precision Surgical Interventions Program, which focuses on innovating surgical techniques to enhance cancer detection and improve tumor removal outcomes. The funding will be administered by the Advanced Research Projects Agency for Health, or ARPA-H, and will be distributed among 8 research institutions across the United States. Notable recipients include Dartmouth College, Johns Hopkins University, Rice University, Tulane University, UCSF, University of Illinois Urbana-Champaign, University of Washington, and Cision Vision in Mountain View, California. This investment is set to target the development of next-generation microscopes and imaging technologies, with the goal of improving the effectiveness of cancer surgeries, ultimately aiming to save and extend lives. Tulane University is set to receive up to $22.9 million to create an advanced imaging system that utilizes structured illumination microscopy and AI algorithms for identifying cancer cells. Dartmouth College will be working on an imaging solution specifically for prostate cancer surgeries, with a total funding of up to $31.3 million. Meanwhile, Johns Hopkins University will focus on developing a non-contact photoacoustic endoscope and a multi-cancer fluorescent contrast agent, receiving a total of $20.9 million. This initiative is part of President Biden's broader Cancer Moonshot program, which aims to reduce the cancer death rate in the U.S. by at least half by the year 2047. Since its revival in 2022, the Cancer Moonshot has been allocated $4 billion by Congress, with $400 million already awarded to various entities to advance cancer prevention, detection, and treatment. Recent DNA analysis from an archaeological site in Mexico has unveiled startling revelations about ancient practices among elites. At the site of Paquime, researchers analyzed the remains of a child buried in what is known as the House of the Well, a ceremonial structure reserved for local elites. The findings indicate that the child's parents were likely very closely related, possibly even siblings, suggesting a practice of close relative mating for ritual sacrifice. The study, led by Dr. Jacob Sedig from Harvard and published in the journal Antiquities, highlights a significant level of consanguinity. The child's DNA exhibited a high number of identical genes, indicating a genetic relationship closer than first cousins. Notably, this analysis revealed one of the highest recorded runs of homozygosity values in ancient individuals from the Western Hemisphere, reinforcing the idea of close familial relationships among the elite. Previous studies suggest that the child was a victim of human sacrifice, an act viewed by elites as a means to consecrate important buildings and enhance family status. These findings provide valuable insights into the social structures and population dynamics of ancient Paquime, indicating that elite families may have engaged in incestuous unions to consolidate their power. Dr. Sedig pointed out the ongoing mystery surrounding the social hierarchy and biological relationships of Paquime's inhabitants. Scholars continue to debate the site's social organization, while the origins and decline of Paquime remain subjects of scholarly discussion. The site, known as Casas Grandes, served as a multicultural center during the 13th and 14th centuries AD, situated between Mesoamerican and ancestral Puebloan groups. Despite its significance as a political and ritual center of the Mogollon culture, much about Paquime's genetic makeup and social structure remains unknown. The child, believed to have been sacrificed in the 14th century, was found in a burial context that underscores the complex social dynamics of the time. Excavations at Paquime have revealed various layers of human remains and artifacts, shedding light on the health and social practices of its inhabitants. This has been your daily brief in science. To read more about these stories, follow the links in the episode bio. You can also subscribe to these updates via email at www.brief.news. For more daily podcasts about the topics you love, visit brief.news/podcasts. Tune in tomorrow. We'll be back with everything you need to know.